Hello everyone. Um, Good evening. Welcome to the first technical session of the course. I have been following, uh, you know, everyone's progress and how you are interacting on the platform. And it's been going great. A lot of interaction to discussions within each other, so that's great. Before we begin, let me address the elephant in the room. I know a lot of you are facing some technical problems on the app. I'm really sorry about that. Apologize for that. And like I said, we had faced, and not just us, but globally on many of similar sites, a technical issue 3 or 4 days back. And since then, a lot of issues have been coming up, including bugs. And, for instance, the site is also a bit slower. Our technical team, who manages the site, they have been working tirelessly for the past few days in making sure that you have the best learning experience as possible. We are hoping all these issues should be resolved in the next couple of days. But in any case, we will make sure that everyone gets some additional time at the end in case needed because of these disruptions. So please don't worry. We will make sure that anyone who got stuck, they get adequate time to finish the course. If that means giving everyone an extra week, we will do that at the end of the timeline, which is the standard timeline which was discussed with you. Just like we have been telling you, if you face any issues, please put them on the WhatsApp group so that we can look at that. And also it helps everyone understand if it is just you or everyone is facing the issue. So that also helps us understanding whether that's an isolated problem or it's a global problem. A key issue that I have seen a lot of people is that the course you cannot start from anywhere that you want. You have to begin from the first module, the first lesson, and go in that order. So if you click on anything which is, which you have not completed or which is not in the sequence, the platform will not let you access that. So please note that you can't go jump around in the course, at least not now. Once you have finished part of the course, then you can go back and look at those modules and lessons again and again, whichever way, in whichever sequence you want. Okay. So with that, let us begin today's session. But before that, okay, let me just introduce the session. So today we are going to talk about supply chain governance. It is a very broad topic, and a lot of time it goes unanswered, I would say, because it's something a bit more strategic at a leadership level. But I think everyone must understand what is governance, despite or irrespective of wherever you're working, because a lot of operational issues are related to governance. So in this session, we will understand what governance is, how supply chains are affected by those decisions, and how is it for Nigeria, for example. This session will be led by Dr. Okafor, who is with us today, I think joining from Boston, USA. Thank you so much, madam, for joining us. So I believe a lot of you already know her, but a brief bio is there on the screen for anyone who doesn't know her. She has been working in the public and private sector, health sector of Nigeria for more than 30 years now. She has a very massive background in pharmaceutical management, research, writing. She has done a PhD in public health, and she is also the head of the Lagos office of PCM. So she brings a lot of experience and a supply chain and health systems knowledge to this course, and she will be leading this session, and then later on, her and myself, we will also lead a discussion session within this classroom session through a breakout group. We will discuss more when it comes to that. So, Madam Okafor, maybe let me also give you slide access so that you can easily move, or unless you can also let me know when to move the slide. Um, we, we can begin if there are no other questions. Let me also put you on spotlight if you open your camera. Yes, excellent. So you are spotlight. Um,
Okay, thank you very much. Thank you, Mr. Sanjay, and good morning, good afternoon, good evening, wherever you are. I hope I'm being heard.
yes, yes, please carry
Okay,
on.
okay, thank you very much.
Perfectly well.
Okay, thank you very much. Okay, you are all welcome to this course. Many of us have not joined, and I know that very soon everybody will be able to join. I'm just going to take some few slides to introduce the supply chain governance while Mr. Sanjay continues with the rest of the slides. And it is very good that we are starting with governance because we can't talk about a system or a program or a policy without talking about the governance that manages that. And what is governance? As a reminder, governance refers to oversight of the structures and processes that enable the direction and the control of a system, organization, and country. You know, it's something that governance is what makes strategic decisions. Governance is what makes the high-level decisions. You know, what sets the tone and makes the policy for any structure or any organization or any country or any system, be it at home, even at family level, there is governance. So that is what guides the power sharing among various stakeholders and orients the responsibilities and actions of individuals and groups wherever they are found. So that is governance. Is a high-level decision-making structure. You know, is that the one that defines the framework and the policies of any system. So when you are talking about the health supply chain and you're talking about governance, it means the structure, the people that take decisions for various aspects of supply chain. And as we know, supply chain has many sides. Governance sets policies and standards. It's also under governance that decisions like allocating funding and resources and other resources are taken. Then governance also takes decisions like defining and coordinating with various stakeholders in that system. It's also under governance that you take decisions of monitoring and evaluation and risk management. Under governance also, you identify roles and responsibilities of various stakeholders and set their related boundaries. It's also under governance that you take decisions that define accountability and systems and communication routes, and also ensure that the system is sustained. So these are the various types of decisions that you take under the health supply chain governance. Next. So there are two major types of governance: the centralized and the decentralized governance. And in between the two major types of governance, you have the mixed system of governance. So in a centralized system of governance, the systems are managed by a central authority, either a national or a federal, that they take all the decisions at one particular level and they control the entire system in the country. So that is when you talk about centralized governance. And in that centralized governance, they take the decisions like at the Ministry of Health and at the central medical stores, and they pass down the decisions to the states or the provinces or the country or the hospitals. So everything is done centrally in some countries. And in those countries, you say that they have a centralized governance of health supply chain. Then in some countries like Nigeria, we have a decentralized structure of governance of supply chain. And in that decentralized structure, The federal government, as we know in Nigeria, we set policies. Federal government set policies at the Ministry of Health level. The federal government does the strategic planning. But in that decentralized governance, the state government, they have authority, full authority to adapt what the federal government has done. And they adapt it to suit their own peculiarities in the state. For example, in Nigeria, there is the National Health Product Supply Chain Strategic Plan, which is 2021 to 2025. And it's under it that like structures like the LMCU, which is the Logistics and Management Coordinating Unit at the state levels, and the central medical stores and the DRS at the states. So provided that all these structures in the states and all these things that the state do, provided that they align with the National Product Health Supply Chain Management, even the DMAs that are in many states of the Federation, that's the Drug and Medical Supplies Agencies, all those ones too, when the states adapt all those policies, they adapt them in such a way that they don't go contrary to what the federal government has done. So this is what we mean when we talk about the centralized system. It means that the policies are taken, the regulations are made at the national level, but that the state has full authority to adapt them, to suit them. And the state also implements and also do some of their guidelines and regulations to come in line with what the national government has done. Then there are some countries that have mixed structure of governance in supply chain. In those countries like Kenya, you find out that their own is mixed. They do partly centralized system, and they also do partly decentralized system. Next. Okay, this is what I'm talking about. You can see that centralized system, that's what Ghana has in their own Ministry of Health. Everything is done at national level, and then step down. All decisions, implementation, everything, control is done by the federal government. But in a place like Kenya, they have the national government doing their own supply chain. Then they have the state government, the county. The county government is like Nigerian state government. Then even then within it, they also have the KEMSA, that the Kenya Medical Supplies Authority. So those ones that are national government establishments, they find out that they also sell to the states, so that the state is doing their own supply chain. The federal government is also doing their own, and they have a mixture of some of the things that they do. And some people have actually wondered that why are we saying that Nigeria is decentralized? That in Nigeria we also do like we are doing mixture of centralized and decentralized. That Nigeria should have been mixed and not decentralized, but it's not, because the core supply chain decisions are taken up there at the federal government when it comes to Nigeria. But the state has the full authority to adapt what the federal government has done, provided it aligns with their own federal government policies. So that is why Nigeria is purely a decentralized governance when it comes to health supply chain. Next. So we're going to have a little 10-minute plenary section. We don't expect everybody to talk at the same time, but we expect people to raise their hands, then we will call them. So we want to brainstorm for what we have said now, that who is the primary stakeholder in Nigerian health supply chain. And when I'm asking that question, I'm talking about who manages different aspects of health supply chain, like the supply chain process, organizational processes like human resource, admin, finance functions, then the stakeholder management of also managing the human resource, employment, recruitment, and then allocation of resources. So I would like people to indicate their interest by raising up their hands so that we can brainstorm a little. As Nigerians, who do we think are the primary stakeholders in Nigerian health supply chain. Thank
Dr. Samuel Adekola.
Okay.
Yeah, thank you very much, Madam Dr. Okafor,
Thank you very much.
Director PCN, Lagos office. And thank you, Sanjay, and everyone. From the lecture so far, we've seen the type of stakeholder, type of supply chain we have in Nigeria, which is being referred to as decentralized. And from there, we've seen various stakeholders. We've seen the federal government as a major stakeholder through the Ministry of Health. And that's one of the primary stakeholders. The Ministry of Health is representing the federal government. Then we also have the state.
Dr. Samuel, just a second. There can only be one primary stakeholder. You cannot have two primary stakeholders. I mean, it defeats the purpose of the question, you know. It's primary or secondary. It cannot be two different primary stakeholders. So maybe just say one, and then we move on to the next participant.
Yes, I just mentioned the federal government, which is represented by the Ministry of Health. Thank you.
Okay, excellent.
The next person.
Maybe you can also comment, who let's say you can take perspective of your states, respective states, or you can look at Nigeria as a whole. Try to see who manages these different functions. So maybe think from that perspective.
Okay, nobody's raising hand again. Okay, thank you, Thank you, Mr. Adekola, for your contribution. And you are very correct, because it depends on the level of the supply chain structure. You are talking about the federal government. So at that level, the federal minister of health, the federal government is the primary stakeholders. Then it depends on where the supply chain structure is. If it's in the states, you're also going to have another primary stakeholder. So the supply chain, so it depends on where you are talking about. Like in the supply chain process, you will talk about the primary stakeholder, then the organizational process, those that are in charge of the administration, the finance functions, and then the stakeholder management of the human resource management and others, and then the allocation of resources. So it depends on the particular place that you're talking about, who is managing what. So the person that manages the supply chain process is the primary stakeholder for supply chain process. And the person that manages the organizational process is the primary stakeholder for that place. And then, so whoever manages that particular process becomes the primary stakeholder for that particular level. Next, please. So there are so many things that affect decision making in supply chain. We talk about supply governance as being strategic decisions at high levels. But as you are taking these decisions, there are so many things that will affect the type, the nature, and the scope of decision that you take under the governance structure. And one of them is funding. Funding policies and availability of funding impact decision making wherever leaders allocate available funding for supply chain functions. Because funding may be adequate, it may not be adequate. So when funding is insufficient, it affects the way that the decisions are taken. And also the human resources. You have to know both the adequacy and the skill sets or the human resources that is in that structure. So for you to take decisions concerning the supply chain, you have to ask yourself, who are the human resources that are going to run that supply chain process? How many are they? Are they enough in number? And the ones that are available, what is their skill set? So that is what will help you when you are taking decisions concerning supply chain, because they help create a skilled, motivated, and compliant workforce, contributing to a better decision-making system for the leaders. So workforce is very important, and that is why I'm happy that many pharmacists are becoming interested in supply chain management, because now we know that supply chain management is now being taught in some universities now on first degree. And it may come to a time when people will begin to think that supply chain is no more for pharmacists, that other people can take them over. But when we now are skilled enough, like all of you now, you are all pharmacists, and you are becoming skilled in supply chain, it will be difficult for anybody to push pharmacists away from any government agency or from any private agency by saying that pharmacist is not qualified. So that is why it is very good that these decisions that we are making, both as individuals and as government, to build the capacity of our pharmacists in supply chain management. Then also the information technology. We also have to look at the soundness, the availability, the capacity of the IT infrastructure in a particular place, because IT is very important for data management. And as we all know, data management is very important for decision making. We need data to provide evidence for the decision making. So when you are making supply chain decisions, you look at, do you have enough funding? Do you have enough human resources? And what is the availability of the IT structures, infrastructure that you're going to have before you can take decisions concerning supply chain structures? Next. Another one now is regulation. Regulatory policies affect supply chain decisions making by establishing rules and standards for supply chain operations. They generally influence supplier selection, product quality and safety, supply chain transparency and compliance with ethical and social responsibility principles. Regulatory policies also impact supply chain risk management, data privacy and security, and sustainable practices. So regulation is very important when you are making decisions concerning supply chain. And even what I said before is also part of it, that government now has made regulation that there will be supply chain as first degree in universities. So when you are taking decisions, you also think of such ways that regulation that government has made will affect your supply chain, both the quality and selection of a product, and then the supply selection. And we also have procurement policies in Nigeria. So these are things also that affect supplier selection when you are doing supply chain. So regulation is very important, both at national level and at state level. So we talk about regulation and also in all aspects of supply chain. Several levels of supply chain now have their own regulation, like procurement. And now there's also good decision practice that's been run by PCN and NAFDAC. So all these are going to affect supply chain decisions. Then the geopolitics also can impact supply chain decision making by affecting trade policies. So it depends on what the policies in that place, also insecurity in some particular places, instability. And that is why in places like Borno State now, they use drone to distribute their drugs, because even in River State, because of places that had to reach some riverine areas. So we find out now that in places like Borno State and Jigawa State and River State, that they are using drones now to distribute their drugs. So when they're making supply chain decisions in such places, they don't just talk about road transport model. They include drones. And PCN is also inspecting those places. That PCN is Mass Council of Nigeria. PCN is also inspecting drones now in different parts of the country, because as drones are people start, apart from using them to carry drugs from one place to the other, there are also as the drugs are being moved, they're also on storage there, they're on transit. So the PCN is also making sure that drones are complying to the standards of storage and transportation. Sorry. Then we also talk about the donor ecosystem. So donor ecosystem can impact supply chain decisions, making a country by influencing policies, providing technical assistance, and promoting transparency and accountability. So when we are making decisions, we also note that there are some people that are donors, and that those donors also sometimes they have their own say in the decisions that we make as supply chain experts. Next. sorry. So we are going to have sorry. This is going to be like all of us are going to participate. And if you don't raise your hand, I'll call your name, please. So what we are going to do is that when you raise your hand, you look at the left side and the right side. So we want to allocate these responsibilities to the proper place where they are. So something like data use policies, you are supposed to say, okay, is it under governance or under management? So if you, so when you raise your hand, you pick one and you say where it's supposed to be. Mr. Sanjay will be the one to lift it and place in that place. So when we have done all of them, then in the next slide, we are going to compare what we have done with what is in the next slide. So who is going to take the lead?
Yeah, Adibayo has raised his hand.
Okay.
Adibayo Oni. Please, you can unmute yourself.
And you tell us the one you are picking and where you think it should be.
Yeah, Adibayo. Okay, then maybe Dr. Samuel Adekola next.
Okay, data
Hello,
use.
good afternoon.
Good afternoon.
Can you hear me now?
Yes, Mr. Adibayo, let's go. Let's
Yes.
go
Yeah, good evening, everyone. Good day.
Good evening.
As you said, my name is Adibayoni. I'm just joining you for the first time. And I met Mrs. Okafor speaking, and I quite enjoy the lecture.
Thank you very much.
But you know, when the person that has it that was giving, you know, you are asking very soon some other people can take over supply chain if pharmacies are not taking or they are not taking the lectures.
Sorry, I'm only sorry. Do you want to ask a question or you want us to finish this section? This assignment that we are doing now. Then we can take your question.
Okay, maybe when you are done then.
Yes, thank you very much. So that we can finish the assignment, then we'll take the questions. The next, we are going to have question and answer, please.
All right, ma'am.
Very much.
Dr. Samuel, then let's start with you. Pick one and put in the right basket.
Okay, let's pick the define process. Governance.
Okay. Next, Mr. Ibisam.
Good evening, all. Managing stock management.
Okay, managing stock management. Okay, next, Dr. Olubisola.
Okay, developing forecasts could be management.
Okay. Mercy Olonio.
Okay, good evening, everyone. Allocating budgets and resources, governance.
Okay. Next, Prudence. Prudence. Okay, can't hear you. Maybe Mariam Idris.
Good evening, everyone. Good evening, ma'am.
Good evening.
Defining procurement methods, management.
Okay. Mariam Shehu. Next.
Good evening, everyone.
Good evening.
Provides enabling legal framework governance.
Okay. Pratham Philibus. Next.
Good evening, everyone.
Good evening.
Defining HR policies, governance.
Okay, all right. Oluchi Mvosu.
Selecting suppliers management.
Okay. Prudence, maybe try again if you are able to hear me.
Okay, good evening, everyone.
Where do you want me to put it?
Governance.
Okay, all right.
Governance.
Chief and Zakiri.
Good evening, everyone.
Evening.
Data use policies,
Okay.
governance.
All right. Abulaji Akinola, next.
Good evening, everyone.
Evening.
Developing procurement plans, management.
All right. Who's next? We have a few more left. Let me put them, bring them to the center. Kiran, you want to speak?
Recruiting staff, management.
Okay, excellent. Who's left? Maybe a few more. Just we have 4 more. So please participate. That will be great. Kingsley.
Okay. Selecting information systems, management.
Okay, going here. Pratham and Samuel, you have spoken earlier. So let's just wait for others to speak. Otherwise, I'll get back to you. There's a lot more who haven't spoken yet. So,
Hello, good evening.
yes.
Good evening.
This is Adeni Yadifolake. Good evening, Dr. Okafor.
Good evening.
Selecting forecasting methods. That's management.
Okay. Go there. All right, Dr. Samuel Adikola, one more from you. Dr. Samuel. Who else? Anyone else wants to speak? 2 more left.
Good evening, Doctor.
Information system, ERP management.
Okay. So 1 left. Madam, 1 more left.
Contract donor agencies. That's management too.
Okay, that's it. So we put it here as well. So now we are done with all. Let's, Dr. Okafor, maybe I take you to the next slide.
Yes, we go to the next slide so that I can compare what we have done with the answers.
Okay, let me try this way. So this is the one which is the correct one. And I think one here is this one is wrong.
I think it's only one, the methods.
Yeah, this one should
The
come
defining, yeah, that was the only one I saw. I noted that was not correct because defining procurement methods is something like a drug revolving fund. The federal government that defines that one. What they call to defining, that means they are making a policy. And it's a method like drug revolving fund. But when you are talking about developing the plan to now execute that DRF, it becomes management. So that is why that defining the method is governance, why developing the plan is management. I hope you are okay with that. But every other thing is correct.
Yeah.
Yes, ma'am. Okay. Thank you.
Okay.
Thank you.
So, the next slide, please.
Can I just quickly make a comment here, madam?
Okay, yeah.
Yeah. So just to emphasize a bit more on this slide and why we created an exercise out of it is because a lot of times in supply chain, we get confused between what is governance and what is management. A lot of people, they think management is only what is governance. Management is only what is leadership, which is a bit wrong, slightly wrong. So that's why we wanted to show you that this is the difference, like Madam mentioned, between defining versus developing. What's the difference? When we're defining, we're setting those policies at a country or a state level. But once those policies are set in, someone has to implement them. So that is management. But whoever is involved in setting up those policies, processes, methods, or allocating resources and budgets, That is where this entire debate of governance lies in. And that is what we are trying to tell you through this session, is that the governance issues are slightly broader and then affect the entire system of supply chain. And that was the entire objective of this slide, to understand how similar looking things can be in both buckets, depending on what is it that is being done here. So policies, processes, methods, all those, when it comes to setting them, is governance. When it is about implementation, that's management. Dr. Okafor, back to you.
Okay.
And I think it's the Q&A.
Thank you very much. So we are going to have question and answers before Mr. Sanjay continues with the next slide. So you can ask your question now, please.
Yes. Mr. Adibayo.
Maybe he's muted.
Yeah, I've just asked him to unmute. Mr. Adibayo, can you?
Hello? Yes, I can hear you very well. Good evening, everyone.
Good evening.
Yes, ma'am. This is my first time of joining the lecture since I registered for this course. It's unfortunate that I've been missing.
This is actually the first lecture. The other one was orientation.
So it seems I'm a bit not following all the lectures. I'm sorry about that, and I've been trying to match up. But what I met you discussing is the issue of the supply chain as regards the pharmacies. But
yes.
I just want to stand to be corrected anyway. What I understand as per the supply chain when it comes to drugs and probably some certain foods, I think that should be channeled towards pharmacies. And if you are talking about supply of other commodities, which I know other people can actually venture into, then that cannot be limited to only pharmacists. But if you are talking about the supply of drugs, the supply chain of drugs, that should be limited to only pharmacists. So that's what I heard when I joined the lecture.
Okay.
I don't know if if I'm correct with that.
Yes, yes.
Dr. Okafor, you got muted.
Okay, thank you very much, Mr. Famoni. Now, this is, you said this is the first time you are joining. What we did last time, what we did last time was orientation. This is the first lecture, so you haven't missed any lecture at all. What you have missed is orientation, which you can always get back. So this is the first lecture, so you haven't missed much.
Okay.
So then, talking about supply chain professionalization, you see, let me take you back to like 2017, when UNICEF came to do what they call human resource capacity assessment for supply chain in Nigeria, and which they piloted in KB, Adamawa, and Bauchi states. When they were doing that, some people were thinking that these people want to come and take over pharmacists' job. And I was telling people with me that the world is moving, and that when the world starts moving, that you cannot hold it, that the best thing that we have to do is to position ourselves strategically to do our work better. Now, the national drug policy has made it clear that drugs are to be managed by pharmacists wherever drugs are. Now, there's also the Procurement Act, which is not only run by pharmacists. Procurement as a job is part of supply chain. Logistics as a job is part of supply chain. Now, the government also has national drug policy and also has Procurement Act. There are some people that are pharmacists that have gone to Bureau of Procurement and they have studied procurement. There are some pharmacists that have studied logistics. And now you are studying the basic supply chain now. What you are saying is that people should position themselves with knowledge and skills. Before, if you are a pharmacist, and we all know that many things that we are learning now in supply chain, we didn't learn them in university. And recently, the NUC had approved logistics and supply chain management as a bachelor degree course in many universities. So by the time these people come out from those universities and they start doing masters also, and they will have PhD in logistics, and you're a pharmacist with B Farm, and you are managing Central Medical Store, the policy will take logistics away from you if you're not careful. Another policy will take procurement from us if you're not careful. So that is why I'm encouraging pharmacists. If you find yourself in a supply chain environment, certify yourself with supply chain courses, improve your capacity, build your skills and knowledge, so that when they start talking about she's not qualified, let me tell you, a pharmacist does not make us supply chain experts, which we all know. So when there's a policy on supply chain, the person will say, okay, you are the one that's managing drugs, but to procure it, they have a procurement act. Then somebody will now say, okay, we are logisticians. And what is logistics? Carrying this product, whether it is drugs or another thing, to another place. And that policy is going to tell you that this is drugs. Yes, we know. We know the storage conditions. And the logistician has been trained to ensure these storage conditions. And when it becomes a federal government policy, what are they going to do? So that's what I'm saying, that the best thing that we are doing for ourselves is what we are doing now, to position ourselves strategically, so that if there's an appointment, nobody will say that you don't know it. We know that, okay, there's an appointment, and we also know it. I want to give an example in what happened in PCN recently, in Pharmacy Council of Nigeria. The government insisted that we must have a procurement unit, because procurement unit is part of what PCN should have. And some of our pharmacists went ahead and became certified in procurement. They went to procurement schools and became certified in procurement. So the registrar took them and put them in procurement unit. Assuming there's no pharmacist that has done procurement in our office, one admin staff will go and do procurement and take over that place. Because nothing says that procurement in PCN must be by a pharmacist. So that's what we are saying, that we should be proactive. So, and that is why I'm happy when pharmacists are embracing supply chain courses, so that we position ourselves strategically anywhere where we are working, especially those in supply chain, so that nobody can tell you that you don't have the certification to do what you are doing. I don't know that I've explained some things to you. Hello.
Good questions. Prudence, maybe you want to speak?
Hello? From Adebayo. Hello?
From Adebayo, you are muted.
Hello, from Adebayo. Is this on this call?
Yeah, he's
Hello,
muted. Okay.
Hello? I don't know that you heard my explanation.
Yes, I heard very well. I'm quite satisfied with your explanation, ma'am.
So thank you very much.
Thank you, ma'am. Yes, ma'am.
We may have a couple more questions. One from Dr. Olu Brisola. She had raised her hand, and probably one from yeah. So maybe we take the question from Dr. Olu Brisola.
Good evening. It wasn't a question. It was just a comment, just to add to what Dr. Okafor had said. It seems as if supply chain management is the new kid on the block. So quite a number of people are interested in supply chain. About, would I say, 10 years ago, John Snow Incorporated asked 12 federal government universities to start supply chain as a model in the university. So all the 12 universities are now teaching supply chain as part of the models in the university. And in the new NUC curriculum, it's a full-grown course in all the universities across board. Also, the medical laboratory scientist is actually offering a program in the University of Lagos for supply chain. And so far, I think only 2 pharmacists have been part of that course. LASU has also started a master's program and is going on to a PhD program in supply chain. And I'm yet to see any pharmacist that is part of that course. So just to buttress what you're saying, the sky is very wide and so many people are interested in the course, but pharmacists are not keen into it to be part of it. So I think it's time that we all joined, and it's a good thing that this course is happening so that we can begin to take our rightful positions. Thank you.
Thank you very much, Fama. Thank you very much. And it may interest you to note that Master's in Supply Chain in University of Lagos, it was proposed to pharmacy faculty. It was the African Research Center that brought it into Nigeria. And they took it first to the Faculty of Pharmacy. And they were still digdaling, and medical lab took it over. Now medical lab is taking pharmacists to come and teach in that place. When I went to Kariska in Ghana last year, that last year we are talking about, they came with a coastal. They loaded people from Lasu to Kumasi for supply chain summit, and none of them was a pharmacist, not even one.
Yes, it's actually a school of transport.
Yes,
in
even when there was a review of pharmacy curriculum, it was reviewed to include supply chain. I was part of that review, that the committee that reviewed our curriculum. We added supply chain courses, a lot of them in 400 level, but you can still not compare it with someone that has gone to university to read supply chain for 4 years, and someone that has even gone to do it to PhD level. So that's what we are saying, that we should be more proactive in what we are doing, and that we should encourage, even now that we are talking about mentorship, Board of Phil is talking about mentorship, I'm very happy. So even now that we are talking about mentorship, we should mentor our younger ones to find out exactly what they want to do, and they'll be doing it on time. Not that we become reactive when something happens, that we should become proactive and position ourselves so that in any way they call us out, we know that we have people and that we're available to do that work. And that we have the competencies to also do it.
Yeah. Maybe let's try one more question, different question if anyone has. Maybe Mariam Idris, I think you tried to speak initially. If you have a different question. If not, if anyone else has any other question about the part that we have done already, we take that, otherwise then we move on.
Okay, somebody is asking if we know CSCA.
Yeah.
CSCA certified supply chain analyst. From Oyelude. Are you with me?
Yes, ma'am. Yes, ma'am.
Yes, you're asking a question, what is CSCA? CSCA is certified supply chain analyst. It's a course it's a certificate course that is organized by ISCA. ISCA is International Supply Chain Examination, I think it's Examination Alliance or something. ISCA, that the owners of CSCA and CSMP and CLPM. So they have certified programs. So you can check it online. Certified supply chain analyst. That's the meaning.
Yeah.
Thank you, ma'am.
Okay, the same thing. Okay, please. What is ASCM? ASCM is Association of Supply Chain Management. It's an association. It's a global association like CIPS. Association of Supply Chain Management. It's an association. It's not it's an organization, but they call them association. And they also have a lot of certification courses, very expensive courses, but they're very good. I think they are based in US. And CSCP, Certified Supply Chain Professional, is also a certificate given by ISCA. So you can check all of them online. This is ASCM is an organization, while CSCP is a certificate.
Thank you, ma'am. Thank you.
Welcome.
Any other question anyone has apart from what we are discussing currently? We still have a couple of minutes, otherwise we move on to the next section.
I'm going to write the acronyms on the chat box. Yeah. So that I can.
Okay. So in that case,
you can continue.
Yeah, in that case, thank you, Madam Okafor. Let us move on to next section, and then we again come back when the breakout session begins. Okay, excellent. So, see, in this section, we discussed what is governance, how what are the different areas that affect supply chain decisions which come under governance. So when Madam explained these slides, these ones. So all these are some issues which are related to governance, like funding, resource allocation, human resources, what kind of information technology systems to use, how regulatory is, involved within supply chain decisions, how to manage geopolitics, stakeholders, donors. So all these are governance issues, which impacts or affects supply chain decisions. Now, in this section, what I want to discuss with you is how three key supply chain operational issues, which we also call, let's say, flow. So flow of products. So when we say products, we mean pharmaceuticals, medical products, supplies, flow of money, funds, and flow of information. So all the supply chain information. So different governance decisions, they affect these different flows. Initially, we discussed whether the governance is centralized or decentralized. So having a centralized governance system or having a centralized system for supply chain will have a different flow of products, money, and information than a decentralized governance system. For example, on this slide, you see this is an example for a centralized supply chain or a centralized governance. So there is a single central supply chain organization who works with probably a central warehouse, multiple intermediary warehouses, and then service delivery points. So when we say service delivery points, these are hospitals, health centers, primary health centers, or any other public health clinics, which takes the which services populations. So in this case, if you see the arrows, the green arrow means flow of products, the blue arrow means flow of information. So it's flowing through the same organization, the central organization. So all the information is fed to the central organization, which is then placing the order. So the one organization is placing the order with the supplier, and then the products come to the warehouse, which is also managed by the central one organization. And then from there, it goes to intermediary warehouses, which are probably at a state level, county level, provinces, districts, from where it can go to service delivery points. So this is an example of a centralized governance system and how products and information flow through in a central system. If we also have to draw a flow of money in this case, it will also be managed by the same organization if they have the power. So it depends on how those power structures are organized. Let's take another example here. This is a decentralized structure. So let's say it's something very similar to Nigeria as well. So in this case, there is no one single organization which is managing the supply chain of the country, but there are different states who are managing their own supply chain. So there might be one single supplier which is probably based in India or China or South Africa or Germany or USA. To that same supplier, different states are placing orders. So state 1, state 2, state 3, state X. So everyone is placing orders for similar products to the same supplier, who is then distributing the products to different warehouses belonging to different states. And then each state is distributing to their districts or sub-level intermediary warehouses, from where it goes to the service delivery points. So if you see here already, with a very simple example, how supply chain becomes complicated already. Even in this example, from a very simple centralized structure to a bit more decentralized structure, we see more arrows, we see more entities, we see much more happening on a slide. So imagine how it must feel when it is happening in a country or a geography. Okay, just Madam Olubukola, do you have a question? You have unmuted yourself, or is it just by mistake? Otherwise, we move forward. Okay, all right, thank you.
Okay, move on.
Yeah, so let's take the example of money. Now, the key question is, who pays for these products? It's a very simple question. So if when a patient goes to a hospital or a primary health center, do they pay for the product, or is the product already paid for by someone else and the patient just accesses the products, and then goes home, by taking the products from the dispensary or a pharmacy linked with that hospital or a service delivery point. So there are 4 typical pathways of how medical products are financed. One is definitely directly by the patient, which we call out of pocket. It can also be through a insurance. It is still by the patient because the patient is then paying the premium for the insurance, but then the premium is far less than the actual value of the insurance. Prudence, there is a lot of echo coming from your side. So if you have a question or comment, please put it in the chat and I will take it up. Otherwise, it gets very difficult to hear. So through patient, it can either be out of pocket, where the patient is paying the full amount of the product and the service that they're accessing. It can be through an insurance, where they're only paying the premium and the insurance company is paying for the products and the service. It can be directly through the government, through the federal or the state government. How does that happen? It happens when the government allocates part of the taxes collected at a state or a country and allocates it for health services and purchase of products. And this is also a very common way where many countries manage their medical supply chain or health supply chain. And then finally, there are donors. There are many donors globally who pay for certain programs and supply chain of those products. So for example, Global Fund, it pays for purchasing and supply chain of HIV, TB, and malaria. There are other USAID is a major donor who pays for multiple programs such as productive health, family planning, some NCDs, sometimes some other, there is President Malaria Initiative where they are paying for malaria, and then some other. Similarly, there are other multiple donors who may pay for certain programs and products linked to that program and also for supply chain functions. So the patient does not have to pay for it. Okay. So the key question then for Nigeria is then, who pays for the products in Nigeria? Is it the patient? Is it the government through taxes? Or is it the donor? You can write in the chat while we move to an example linked to flow of money. So as you see on this slide, this is kind of an example for a DRF scheme in a mixed system. So it is neither centralized nor it is decentralized, where both players are active. So there are certain areas or programs or supply chains which the central system is managing, while there are certain programs or products or areas which the state is managing. So what happens is, in a DRF scheme like this, the money which is collected at the service delivery points is then reallocated based on that program structure, goes to that fund, which is then accessed by the health service department or the supply chain department of the state or the country, who then pay for purchasing more and more products through the supplier. In this case, the money is going from the pocket of the patient in the pool, which is accessed by the state and the central level for purchasing more and more products from the supplier. So this is a way to see how the flow of money is happening in a mixed structure. Okay, couple of points from the chat. Patients pay for their drugs. For donors, yes, they don't pay, but essential medicine with some mix out of pocket and some insurance. Okay, excellent. So that's how it is in Nigeria. But maybe let me ask you another question linked to this. Which is the higher proportion? Is it out of pocket? Does it include, so if we take three scenarios, that it is donors, out of pocket and insurance. So out of these three, which has the highest proportion? So in terms of percentage, so maybe answer that in the chat next. So what is the most common, or what has the highest proportion in terms of, okay, so out of pocket has the highest proportion. So see, in this case, if out of pocket is the highest proportion, then for Nigeria, a financial management system which can be most common can be drug revolving fund. And I know for a fact that lots of states are already doing this, and I think it has become a policy as well. But I think a lot of many states are still struggling, to institute one. Maybe Dr. Okafor, if you have any example or any, any case that you know of drug revolving fund, maybe you can chip in here. But otherwise, I will move forward. Yeah, okay. Someone is saying a lot of states are setting up DRF and drug management agencies, Yobe, Kano, Jigawa. Yeah, exactly. So this is probably the way to go for Nigeria, since out of pocket is quite prevalent. But then it is the responsibility of the government, the state government as well, to try and make sure that the products are subsidized as well. Because think of this scenario, so a product, let's say a hypertension medicine, it is available in the private market, and it is also available in a public health facility, primary facility, maybe not primary healthcare, but maybe a community healthcare facility or a hospital, let's say. If the price of that product is same in both places, private and public, what do you think the patient will choose when they are to buy that product? Whether they will choose the private pharmacy or they will choose the hospital. Also, the public sector has to make sure that the product that they are selling, their price is not higher than the private sector. At least they have to match it. In most scenarios, they have to subsidize it, but they will have to try and at least match the price. So imagine what will happen if the prices are same, or if the price in the public sector is higher. So think of it and write in the chat what will happen if the prices of products are same. Where will the patient buy from? What is most likely? Let me move forward. The next thing is information. So like I said initially, information technology is very, it's a very important aspect in supply chain, because information itself, data and information itself, is key in managing any supply chain. Supply chains, they evolve every day. Supply chains, it's a continuous thing. So you cannot just take a decision and let things happen. It doesn't work like that. In supply chain managers, supply chain managers and leaders, they always have to be on top of what is happening, which has to be guided by data and information. So hence, information systems are key. Now, we know that there has been a significant investments by donors in instituting different types of LMIS systems in Africa in general, and I know for a fact in Nigeria as well. Many countries have different ELMIS systems as well, but having gone through these 2 points, but there is still a lack of accountability on data collection, reporting, and quality. So it is very important to understand when we talk about information and data, it is not only about having an ELMIS system or a mobile-based system or any electronic system. The system is secondary. What is more important is the accountability on collecting that data, reporting that data, and making sure that the data information is of high quality. Because if the data and information is poor, then the decisions you will make will also be poor. So LMIS means Logistics Management Information System. ELMIS is simply the electronic version, which means either it can be, the data can be collected and reported through a computer or a mobile or something mix of that. So think about an HMIS system, Hospital Health Management Information System, where you record patients' data. So LMIS is simply a version to collect and report logistics data. You will read in the course later more about LMIS and what kind of data also is collected. It is coming in module number 6. Okay. Any other question? Let me see. So most of them are saying patients will buy from hospitals and from the public sector if the price is same. But someone is also saying that the prices of products are also higher in public sector hospital. But let me take you to another scenario in this case. There are less number of public health hospitals and more numbers of private pharmacies. And I believe it is same in Nigeria as well. So if I am a patient, there is a pharmacy which is literally in the block where I live in my community, and I know for a fact that my doctor has prescribed me this medicine. Will I waste, let's say, 5,000 naira to go to the hospital and buy the medicine from there, or will I just walk down the road and buy the medicine which has the same price in the pharmacy in my community? Think like that. And then say, what will the patient do? So, as a matter of fact, public sector should have prices less than the private sector. Otherwise, it will be very difficult for public sector to survive, because what will happen, they will not be able to sell the product. The product will expire eventually. And in all this, the key thing is to note is how we decided the price. And that is a governance issue. So think like that. All operational issues, they have a stem in governance and decisions taken by people who are governing the system. Okay. Okay. So now let's look at a chart again, a flow, which is information, and for a decentralized system. So in this case, now this is a decentralized system. So service delivery points will collect, let's say, stock data. Using that data, they will send replenishment request to the state body. The state body may send to the supply chain system at the state, and the state supply chain organization, in this case, whether probably it's a DMA linked to an NMCU or any other organization, they will then send the orders directly to the supplier. So this is how a decentralized system will work. In a centralized system, all this data from different states and different health facilities, different service delivery points will go to a single supply chain organization who will consolidate everything and then make purchase requests for the entire ecosystem. But in this case, every state, every county, every district, depending on their powers, they're doing it by themselves. So imagine if every state in Nigeria is purchasing for themselves, is there a loss of purchasing power or not? Think about it and maybe write in the chat. So this is, in these slides, what we had wanted to discuss and show you how governance decisions, how issues which are related to governance affect flow of products, flow of money, and flow of information. SDP is service delivery point. Service delivery point is a standard name for any clinic, pharmacy, health center, hospital where you can buy a product, where patients can be serviced. That's a standard meaning. So we say service delivery point so that we don't have to write everything, but when we are saying service delivery point, We mean any kind of point. It can be a hospital, it can be a health center, it can be a pharmacy. So just to make it a bit more generic. Okay, so like I was saying, you see how different flows they get impacted by governance decision. So the last part of today's session is a small breakout group discussion where we will discuss this point, information, because this is a key thing for any supply chain. Information is key. Okay, so we will look at a small discussion. We will do a small discussion focusing on data governance. So how supply chain data should be governed in any supply chain, for example. But before we do that, if you have any questions, please, you can ask them now. Otherwise, we'll move on to the breakout group, and I will explain how the breakout group will work. Please, if there are any questions, you can ask them now regarding what we have discussed so far. Okay, it seems there aren't any questions. So then we can go to the breakout group. Okay, so how will this work? So the key question here is, what is the ideal scenario for flow of logistics information within a supply chain? But it is not a very simple question. There are lots of nitty-gritties linked to governance of data in any supply chain. So I believe all of you have received an email from Priyanka. There was a Word document which was attached there, which I have already also put in Zoom chat. So you can download from here as well. What we will do is we will divide you into two groups. One group will be guided by Dr. Okafor, and the other group will be guided by me. What we want are two group leaders. So please raise your hands if you wish to become a group leader. The key requisite being the group leader should be able to share their screen with the document on the screen and write the key points which are discussed in that group. Okay, so two people who can share their screens, have the document with them, or you can download it from the chat, which I've posted here, should become group leaders who will write the answers as per the discussion in the group and then present when we come back in the plenary. So please wait if you identify voluntarily, or otherwise we'll have to try and make two group leaders. It's a democracy everywhere. So we don't need an election to do. We don't need an election here. Let's make it easier by going voluntarily. Haruna, you want to be a group leader? I'm not sure if I understand your text. Maybe just raise your hand if you want. Okay, Ogbuche, she will be one group leader. Oh, sorry, he will be one group leader. Excellent. Ogbuche, thank you. Who is the second one? Haruna Zakaria. Will you be one? I'm not sure I understand your message correctly. Okay, so again, the group leaders will share their screen. Okay, write the answers to the questions which are asked in the document, and then we come back. You will also, represent your group and talk about those questions. Is it okay with everyone? The rules are okay. I'm going to divide the entire group, the entire class into two groups, which I'm doing right now. Let me also make sure that both of us are in two different group. Okay, so once again, the document has different questions. You have to answer those questions, write them in the document. The group leader writes that. We come back after 30 minutes. So we have 30 minutes. Okay, so we take that 30 minutes. We come back and the group leader explains what has been discussed, and then we can also ask questions. So I'm opening the rooms. You will automatically go in the allocated room. If you're not able to go to that allocated room, there will be a join room option on your Zoom screen. You can click on that and you will go to that room. I can also, once when I'm guiding the group where I am, I can also go to the other group in case there are any questions. You can raise that question from your own groups. Okay, so I'm opening the room now. We should start the discussion very quickly because we don't want to keep anyone waiting once we finish the time. Okay, here you go. Okay, we are just waiting for everyone from the other group to be back as well. And then okay, so the other group who was with Dr. Okafor, I think Zakaria Haruna, you were sharing your screen. Maybe you can do a quick debrief by showing us your sheet and explaining what has been discussed. And then after that, the group who was with me, so Oguche from that group, then you go and you discuss what has been discussed. Okay. So Zakaria, would you like to take lead, please? Excellent. So we only have about 2 to 3 minutes, so we have to be quick because the same question will be answered by the other group as well. And then everyone else, please, if you have any questions from each of the groups, please do ask them or write in the chat. Haruna, over to you.
All right, thank you so much, Sanjay. We had a robust discussion in the group and we came up with the following input. So for the first key point, the purpose of collecting and analyzing data, we agree that we collect and analyze data to be able to make us have informed decisions, make forecasting regarding drugs and other commodities. You know, we know the lead time because in hospitals and other service delivery points, you need a very good lead time to be able to supply drugs. So you need to understand what the lead time is for you to be able to, you forecast, procure commodities. You also need data to understand utilization patterns of drugs, and also identify issues or problems in the hospitals or regarding any drug system. So decisions that can be made using data are: one, quantity of drugs to be procured, maybe in the hospitals, in the other service delivery point, maybe in the hospital pharmacy, and so on and so forth. Prognosis, health outcomes, capacity building of personnel, your human resource needs, how many people do you need in a pharmacy, how many people do you need in a store, how many, or a warehouse, or how many people do you need to be able to train, supply chain personnel. And then you also need data to be able to monitor and evaluate programs. Even your decisions too, you will need data to, monitor and evaluate it. You also need data to measure trends of diseases, the action of drugs, to also determine program impact for research purposes, and also to design interventions. So for our sources of data, we classify sources of data into 3, basically primary, secondary, and tertiary. For the primary, we have examples like patient interviews or clerking of patients in the hospitals, doctors' prescriptions, and so on and so forth. And for the secondary sources, we took patient records files, caregivers and relatives as examples. And then for tertiary sources of data, we picked medical textbooks, Pharma News is a magazine, pharmacy-related magazine in Nigeria, and then we also have standard treatment guidelines. For those that are responsible for collecting data, we identified 4 key personnel. This is not exhaustive, but these are what we were able to identify looking at time constraint. Logistics management information officers in our records department, monitoring and evaluation officers, health professionals, relatives, and caregivers. For the storage of data, even though not written here, but we've classified data storage practices into 2. One is the e-storage, and the other one is the hard copy storage. So for the e-storage, you have like electronic medical records or electronic logistic management information systems. Then for the hard copies, we have the records files that are kept in the records department, in the hospitals, in the pharmacy, and so on and so forth. And you also have the diaries. So other things that could be done with data include policy formulation. For example, in the treatment of HIV and AIDS, it was formulation that led to the inclusion of dolutegravir DTG in the treatment guidelines for HIV. Also, the inclusion of artemether was a policy formulation by the federal government that led to the inclusion of these drugs into these different disease areas. We also need to make strategic decisions. For example, if you're operating a DRF system, let me use that as an example, and then you have the policy says that all hospitals, primary health centers, for example, should should tailor all their drug needs to the drug and medical consumables agencies. And so you find out that some days they are not coming to that place. So what's the problem? You make a research on that and you come up with a strategic decision. Probably there are some drugs that they come to pick up and they're not available. So you have to make a strategic decision on that. You also do research with data and you also do operational decisions. So we identified different ways by which data quality is checked. Its completeness, how complete is the data for the purpose for which you are collecting the data? Timeliness, is it at the right time that you're collecting this data? Or, because there are some data sets that are time bound. If you don't collect them at the right time, they cease to become useful. Precision, how close are the data sets agreeing to each other? Then validity, how valid is the data for that particular purpose for which you are collecting it? How accurate is the data too? So all these are ways of checking data quality. So Mr. Sanjay, this is what our group were able to come up with.
Excellent, excellent. That's great. A round of applause for Haruna and the group. I think there's a question from Dr. Samuel. Dr. Samuel, you can ask the question now.
Thank you, Haruna, for your presentation. Very good one. My question actually was has to do with source. At which level source where the data should be collected. Here he talks about primary source, patient interview, data, secondary source, patient record files, tertiary source, medical textbooks. So I see a little confusion here because the data we're talking about here is a data that is related to the products, the movement of the products from of course, data that has to do with the product which the governance which is needed for,
supply chain. You mean supply chain of products?
Yeah. So I really don't think what you itemize here aligns with supply chain data in terms of patient interview, patient records. Medical textbooks, those pharma news that cannot produce those sources cannot give supply chain data. I stand corrected.
Okay.
But it's my view.
Maybe there is one more hand raised. Maybe we just check that and then Haruna, you can respond. Dr. Olanike, is there a same question or different question?
Yes, please. Thank you very much for that presentation. Very good. I also observed the same thing as the last speaker, that the supply chain data we're talking about cannot be from books, nor from caregivers. And then I'm also wondering the purpose of information. Would you have improving patient health outcomes? Will that be an immediate purpose? I'm just wondering.
Okay,
I think they
Haruna,
have
over
it
to
there,
you.
yes, as to improve patient health outcomes. I'm not sure that's a primary purpose for that at that level for supply chain.
Okay, so Haruna, either you can respond or anyone from your group can also respond to these two questions. Over to you.
What it means there is that if you address the supply chain concerns of movement of drugs from point A to B at the right time, and things like out of stock are handled properly, the patient get the drug at when needed, the patient outcomes will be improved. It's an immediate action arising for proper planning and forecasting. I think the point should be, it's in order in that regard. Thank you.
Great response. What about the other question
Okay,
about the
so
source?
for the sources of data, we stand to be corrected. However, if you look at, when you conduct patient interviews, you could know what drugs a patient has been taking for a particular illness. When you prescribe the drug and you check out the doctor's prescription, you could also know what drugs, what quantity of drugs, for how long this patient has been taking these drugs and so on and so forth. So it's also a logistics information. It's also tailored towards this. For the records files and caregivers also, if you check patient record file for inpatient, that patients that have been on admission, you could also see what drugs these patients have been on over a period of time, and so on and so forth. And so also our STGs too contain standard treatment guidelines, what drugs are used for particular ailments and so on and so forth. Yes, please.
Okay,
Yeah,
Manu
okay.
Kahinda, you want to say something?
Hello?
Okay. Okay, please carry
I'm
on.
thinking, okay, so in line with what the observation that was raised, I think if in regards to supply chain and logistics, we should actually be looking at our bin cards, our delivery notes, our proof of delivery, our consumption, sort of, I think.
Thank you, you are right.
That would be more relevant to our logistics information.
That's right.
Excellent. Okay, that's great. So I think great job, this group. I'm not sure which is group 1 or group 2, but the group led by Haruna, great job. Let's quickly go to Oguche and his group. Oguche, over to you. You can quickly share your screen. Although a lot of things this group has written is very similar to what you and your team members have written, but please, you can also quickly explain what has been discussed in your group. Oguche, over to you. Oguche, you're muted.
Okay, so good evening, everyone. This is for group 1. I'll just go over what we agreed on as the group. So we looked at the various questions and then we came up with the following answers. The first one talked about the purpose of collecting and analyzing data. And we said the data, that supply chain data in this instance, is used for decision making. You can use it to evaluate the supply chain performance. You can also use it for forecasting, for determining trends, that you can identify trends with regards to consumption pattern, and then you can also use it for R&D. So we looked at the other question which talks about decisions that can be made using the data. So you can use the data for product quantification, for identifying trends, for policy review. So once data is collected, and maybe with regards to, let's say, for adverse drug reaction, once upon a time in the HIV care and treatment program, staff within what to use, but a lot of complaints with regards to adverse drug reactions kept propping up, and eventually that drug was removed from the treatment regimen. And so with the collection of data, you can also use it to review policy. We also said you can use it for product selection, to determine products that you can use in country. You can use it for price review, and then you can use it for setting measurable goals that you'd want to attain, maybe in your supply chain maturity, as the case may be. The next question talks about source. At what level should data be collected? So it says data can be collected at the service delivery point, at the point of care. At the state level, it can also be collected at the drug management agency, the central medical stores, and also at the national level as well. So for us in Nigeria, we have each states have their CMS or DME, as the case may be. At the national level, we have the national central medical stores in Oshodi, and then the one in Abuja. So from there, you can help the data that you aggregate from across the country to determine maybe like a national forecast or so. Then who should be responsible for collecting data? We said the service provider, the data collection officer, and then the logistician at the various source where the data is collected. How should the data be collected and stored? So for us, while we're deliberating, we added collected here because the original question talked about how data should be stored. But we tried to look at it from the angle of collection and then storage. And so we say data can be collected real time using barcode scanners. Data can also be collected offline. That's data that has to do with consumption data. And then for storage, we say data can be stored electronically at the local server, and then it can be stored in the cloud. That's cloud-based storage. Collection can also be paper-based, which can be as a backup. And at the lower levels where you will agree with me that the use of barcode scanners and all the electronic devices may be impracticable, you can also use a paper-based. The next question talks about what else could be done with the data. Having deliberated earlier, we now came again and then came up with some other uses of this data. So we say data can be used for budgetary purposes. You can use it for risk management as well as auditing. And then the final question talks about how is data quality checked. So we talked about validation, timeliness of the data, consistency, and then completeness. So overall, this is the outcome of our deliberations in Group 1. Thank you.
Excellent. The group represented by Haruna, do you have any questions for Ogbuche and his team members? Please, you can speak now if you have any questions. Okay, it seems no questions. So great job, Ogbuche and team. I hope again. Let me quickly summarize this. Breakout group discussion as well. The reason why we wanted you to do this with respect to data is because there's a lot of time when donors and partners, we invest a lot in ELMIS systems. And we believe that investing in ELMIS systems will help supply chains and will help our data information systems. But it will only be improved once we look at this entire spectrum of data governance. So a lot of people may not ask you these questions and may not think about these questions. But if you are getting trained in supply chain, make sure that you understand the role of data in supply chain. And it is very, very, very important. But when you talk about data, you talk about all these questions and much more. Okay, there are other questions which we haven't put because it will be a very long discussion then. But these are some core questions that you need to ask, understand, debate, because it is not just about systems, softwares. It is about the culture of collecting data, analyzing data, making decisions, and figuring out how this entire process will improve the supply chain. And then someone, I don't remember, I think Stephen, you said, eventually will help improve health outcomes in patients. So with this, I don't think we have anything else on the slides. Yeah, so this was the end of today's session. I'm sending a quick poll on WhatsApp right now to rate today's session. We would be really happy to understand how you liked today's session. The interactions, the content itself. So please rate that. We will be very happy to see. But otherwise, if there are any questions about today's session, please, you can ask me. Any technical platform related questions, you can ask on the WhatsApp or to Priyanka. But like I said initially, there was a global issue that had happened, which our site also got affected by. So we have been trying to sort that, and because of that, some other issues have started to come up. It has kind of become a domino effect. But we are very hopeful and confident that it will only last for the next few days. So hopefully in the next few days, everything will become regular, usual, and you won't have to face any further issues. But we will make sure that we give you additional time if anyone has lost precious time because they were stuck and could not move forward. So if you have any questions, please, you can raise your hand, you can speak, you can put on chat. But otherwise, I will be ending this session in the next minute or so. So thank you so much. I hope we will keep on discussing on the platform itself and keep on going through the learning journey. Some students were stuck at a quiz, which is a very specific issue on the app. So if you're stuck at the quiz, please attempt it on the web, on a browser. It should work. And then you can keep doing the other lessons on the app itself. But we're trying to fix it. As soon as we fix it, we will let everyone. So thanks a lot. And